with just hours before most South Africans are off work and school for the year, health concerns remain at the forefront of discussions in homes across the country. Possible lockdown restrictions loom, with news of the National Coronavirus Command Council meeting this week as well. Yesterday, overnight, almost 24,000 new cases reported around the country, with a test positivity rate of around 35%. Another 24 people also succumbing to the virus, and nearly 600 more people hospitalised. So in light of all of these very worrying numbers, how should families protect their vulnerable loved ones this holiday season? Let's get you some advice now with the National Department of Health's Head of Vaccinations Program, Dr. Nicholas Crisp, who joins us now via our video link. Dr. Crisp, good morning. It's great to have you with us on the program this morning. And that's really the decision for families here in South Africa and certainly around the world as well. What do I do? I want to see loved ones that perhaps I haven't seen for even the past 20 months in some cases. What's the best course of action for me and my family?
Good morning to everybody, and thank you very much for having me on the show this morning. So, yeah, look, I think that the same tried and tested measures are the ones that we have been promoting all the time, and that we'd still encourage. Always wear a mask, make sure it fits well over your nose and mouth, and that you're not breathing and spitting over other people. Keep a reasonable distance from people that are not part of your immediate family, that you're not, with every day. Make sure you're in ventilated spaces as far as is possible. Avoid large gatherings. I know that people want to gather over this time, but that's not the smartest thing to do at the moment. And wash your hands or sanitize them as frequently as possible so that you reduce the transmission of the virus. And then hopefully people have been vaccinated in preparation for the holidays, because we know vaccination does still offer a good measure of protection.
The vaccination program, Dr. Crisp, how are we doing, in terms of our coverage for the population in South Africa ahead of this festive season? Are we where we were hoping we'd be at this stage?
No, unfortunately we're not. We've not got to the 70% of adults with one dose, which is where we wanted to be by the time we break, which is pretty much by tomorrow. Some provinces are over 50% of adults have been vaccinated. 3 provinces, and that's the Western Cape, the Free State, and Limpopo, are over 50%, and the Eastern Cape is very close to that. So it's still a far cry from the 70 we would have liked. Some of our sub-targets we have reached, and we are very pleased about that, and those are to protect older people. So older people over the age of 60 have been far more vaccinated than younger people, and they are the ones who are at greatest risk of severe infection and hospitalization. So we're very happy with figures that are upwards of 65% in some provinces, and in fact in Limpopo over 75% of people in that age category are vaccinated. So it's a bit patchy, unfortunately, and there are parts of the country where vaccination has not been anywhere near the goal, which is most unfortunate. But, yeah, there are a lot of people who have been vaccinated, and we have administered well over 26 million doses.
I suppose the worry now, even though, a large portion of our population, as you say, has been vaccinated, perhaps not at the targets we were hoping, but still, as you say, some of those sub-targets have been met. But now the research showing that the efficacy against the Omicron variant, specifically the study that noted the Pfizer vaccine giving a 33% protection against Omicron, does that somehow sort of put a dent in the kinds of strides we would have been hoping, particularly against this variant?
Well, of course, we don't know about variants until they arrive, so that obviously is disappointing when you don't get the levels of coverage. There are always silver linings amongst disappointments. So I think, yes, we have seen that Omicron is not responding in the same way, and there is immune escape, and people are getting infected despite having had 2 vaccinations with Pfizer. But we've also seen those that have had infections prior to vaccination doing pretty well. So I think the message is that vaccination is, immune response is not only about antibodies. And people who are getting this particular variant of the infection are getting ill, but they're not getting the kind of severe illness that we were seeing prior to vaccination. So there's still a good measure of protection, and even if it's not at the levels we were expecting before. So vaccines are still offering quite a good protection, and especially for older people who we know are the most vulnerable.
Yeah.
So we are still pushing that vaccination is very much part of our protective program, and we would still encourage everybody, whether it's with the Johnson & Johnson or a Pfizer vaccine, to go out and get vaccinated.
Dr. Crisp, in light of this study around the efficacy of the Pfizer vaccine, I've not seen any information around the efficacy around Johnson & Johnson and the Omicron variant. But does this now mean that there's going to be more of a focus on the issue of booster shots against Omicron?
Well, yes, there will be emphasis on booster shots, but of course, our bodies have to generate that immunity. A vaccine is not a medicine, so that it's not an immediate response. Your body needs to make the antibodies, and if we stimulate the body with another dose of vaccine, then that's what we want, to get an additional boost of our own immunity because of the stimulus we're getting. So yes, we do want to boost. We have a schedule now that will commence in January, because that's when the 6 months is up for Pfizer. Mm-hmm. And we're hoping to hear before the end of this week about the schedule for the boosting of those who had Johnson & Johnson vaccine. I think people do know that for some weeks now we have been vaccinating healthcare workers who started their vaccinations on the 17th of February. There's quite a lot of information available about how the Johnson & Johnson boosts are doing, and there is a dossier that has been submitted to the Health Products Regulatory Authority. More data, I understand, was submitted yesterday, and they are working flat out to evaluate exactly what it is and to give us advice on the timing and when to start with those vaccinations in the broader public.
Mm. Are you concerned, Dr. Crisp, with some of the delays that we've seen with reporting our surveillance data? I mean, what kind of impact does that delay in the data that we do get? So, for example, this week we saw quite a big delay. I think it was 19,000 cases that were part of a backlog due to an IT glitch, which were then sort of tagged onto Monday's numbers, I think it was. You know, what kind of issues does such an IT glitch present for the work that you do, if anything?
Yeah, no, nothing, because we are watching trends rather than absolute numbers. Mm-hmm. Obviously, we're concerned that the numbers do show, huge rises or very low rises, and those do impact how comfortable we're feeling about what we are doing. But we have been watching, we watch the trend. So if, for instance, we have something that has happened in the past week, and over a whole week, because of a security upgrade, there's a delay in getting results through, that is spread over a period of time. It doesn't change the shape of the curve. It may change the height of the individual points on the curve over that period, but it doesn't change anything in what we know we need to do to respond. Mm-hmm. So we're not particularly concerned from that perspective, but obviously we want to be confident that the data that we're getting is accurate and complete, because that's how we get a better picture of what is going on. Yeah,
yeah. Almost 2 years into the pandemic, Dr. Crisp, and there's so much analysis being written in reportage around the world that this pandemic, the Omicron variant, it's all a dress rehearsal, really, for the next pandemic that we'll face as a globe. You know, the work that we're doing now in terms of detecting, tracking and tracing, slowing the spread of the virus, do you reckon we are meeting all of the goals that we're setting in terms of those three issues? And will we be better prepared? I mean, is this a morbid discussion to be having with you? Will we be better prepared for the next pandemic?
Well, I think the big